Assalamualaikum and hi to all. First thing first, we would like to thank our beloved lecturer Dr. Nurul Harani for guidance. We will also would like to thank the Infectious Disease Unit from IIUM Medical Center for the sharing and also for the hospital of course. And not to forget to our fellow classmates that made the visit memorable. Wait, here I share the picture. So in this presentation, me and my colleague will be share about transmission infection at workplace. To be more specific, the workplace that we'll be focusing more is in the hospital setup. But before I further do the presentation, let me introduce my fellow team members because like people say, no love without knowing. So my team members consist of Anis Abdullah, Aini, Asma, Ayuni, and last but not least, myself Amjad. Alright, without wasting more time, let's begin. As I mentioned earlier, there's a term that we used to describe transmission infection that happen in the hospital setup, which is HCAI, which stands for Healthcare Associated Infection. Also, can be known as nosocomial infection. However, both terms brought the same things, which is referring to infection that people get infected from the hospital environment. People always mistaken that nosocomial only can infect patient that is hospitalized, but in fact, everybody that go back and forth from the hospital is prone to get nosocomial infection, especially healthcare worker or people that work in the hospital environment such as physician, nurses, lab technician, cleaner. So many people So what is actually infection? According to the World Health Organization, WHO, an infectious disease is an illness resulting from an infection and is caused by pathogenic microorganisms such as bacteria, viruses, parasites, or fungi. In hospital setting, the most three common infectious disease are bacterial infection, viral infection, and fungal infection. These three infections can be transmitted in various ways, such as bloody fluids, skin contact, airborne particles, contact with the feces, and also by touching an object already touched by an infected person. So many variety ways the disease can be transmitted. So stay safe, stay clean. So for the next, I will pass this baton to my other member teammates.
Assalamu alaikum. My name is Esma, and my part for this presentation is about the mechanism of transmitted infection in healthcare workplaces. There are two types of mechanism: direct contact and indirect contact. Direct contact happens through two ways, either through droplets by coughing and sneezing, or through person to person by shaking hands or exchanging bodily fluid. This happens commonly in hospitals due to sick patients. The indirect contact happens through two ways also: airborne transmission, which is microorganism that stays in the air for so long, and contaminated surfaces or contaminated objects like needles or desks, just basically that the infection is on the contaminated surfaces due to the patient. There are a lot of common infections between healthcare workers. The most important one of them are hepatitis B, tuberculosis, HIV, and SARS. Hepatitis B is a virus that damages the liver cells, causing hepatitis. Tuberculosis is a bacteria that affects the lungs and it damages the cells. And the HIV happens through needle prick injuries with an infected needle from a patient who has HIV, reducing the host cell's lifespan and immune system. SARS, for example, what we're seeing right now is coronavirus, which is a virus that mostly attacks the epithelial tissue of the respiratory tracts, resulting in an alteration of the alveoli, causing difficulties in breathing.
Risks and consequences of transmission infection among health workers will be varied based on condition. Not all conditions will give the same outcome. The consequences not only affect the individual, it also affects the whole team, the hospital management team, and even government. So today, I will focus on risk of needle stick injury because needle stick injury ranked the highest among all injuries. In Malaysia, from 1998 to 2005, needle stick injury alone contribute to 74.9% among all injuries, while in the United States, approximately 1,000 needle stick injury being reported every day. In United States, 39% of infected health workers due to needle stick injury being infected with Hep C virus, 37% being infected with Hep B virus, and 4.4% being infected with HIV. The infected health worker will be receive AZT therapy and other additional treatment for at least 6 months. This long period treatment will induce stress and fatigue to the individual. One case reported in US stated that an infected health worker developed depression and anxiety while receiving treatment due to 1 year unemployment. Even the government also in risk indirectly due to transmission infection. It is approximate that needle stick injury cost the US government $750 million annually due to transmission infection. The costs include counseling session, blood tests, and also treatments.
I am Ayuni Mardah Midil Zaidi. Now we will proceed to the principle of infection control and prevention, which is the universal precaution. This is also known as standard precautions that are formed in order to protect the individuals from workers to patients from disease transmission. The first one is hand hygiene. As hands are the main area for direct transmission of pathogens, this becomes the most crucial step. Washing hands can be done either with using soap and water or by using hand sanitizers that contain 60% to 95% of alcohol concentration. CDC also recommends to wash our hands for at least 20 seconds. Next one, the use of personal protective equipment or PPE. The items such as gloves, masks, and gowns are important in order to create barriers between the individuals from infectious agents. Number 3, needle stick and short injury prevention. This is to ensure that workers are prevented from exposure to blood-borne pathogen when dealing with needles and other sharp devices. Number 4, respiratory hygiene and cough etiquette. This implies to both workers and patients in order to prevent respiratory disease from being transmitted. For instance, nose and mouth must be covered with tissue while sneezing or coughing. Number 5, waste disposal. The level of waste in the container must always be monitored as it needs to be replaced when filled up to the indicator. Lastly, safe injection practice. This applies to the workers who involve in injection to the patient. Every time an injection must be done, new needle and syringe must be used.
So now we'll present about the principle and precaution transmission-based precaution. So transmission-based precaution is implemented in addition to standard precaution to prevent the transmission of infectious disease agent, especially the emerging disease. For example, our pandemic COVID-19 right now, from a patient to another people. So these precautions are applied to the patients who are suspected or confirmed to be infected with infectious diseases, and also to the patients who are asymptomatic but suspected to harbor the agents. So these precaution steps will be implemented after the standard precaution applied before did not completely interrupt the route of transmission of the agents. So there are 3 categories of transmission-based precaution or TBP, which are categorized according to the route of transmission of the infectious agents. The 3 categories are contact precaution, droplet precaution, and airborne precautions. If there are diseases that have more than one route of transmission, there will be more than one TBP to be applied. So firstly, contact precautions. It is implemented to prevent the transmission of the microorganisms either through direct or indirect contact from the patients to the people around them. The people around them includes the doctors, nurses, and also other patients. Besides that, contact precautions are also implemented when the presence of the patient's body fluid such as blood, stool, saliva, or other body discharge are suspected to be highly contagious. So these are the procedure for contact precautions. The first is by isolating the patient from other people, either in a room or in ward. And next one is the ambulance used to transfer the patients or also need to apply the contact precaution procedure. And the third one is the healthcare practitioners need to wear proper PPE that comply to the contact precaution measures. And the fourth one is the patient movement are to be restricted so that they do not spread the diseases around. And the fifth one is the room used by the patients need to be cleaned and disinfected after use. And lastly, the equipment used on the patients are better to be disposed. Next precaution is droplet precautions. It is implemented to prevent the transmission of the infectious disease agent from the respiratory organ, either through coughing, sneezing, or talking. To prevent the transmission of the agents, the patient must first wear masks and also will be separated from other people in a room or ward. And the rooms that a patient is staying need not to have a special air ventilation because the agents will not remain infectious for a long distance. And also the health practitioner also need to protect themselves by wearing a proper PPE. And lastly, the patient movement needs to be limited. Next one is the airborne precautions. It is needed if the patients were infected with microorganisms which will remain infectious when they are in air. Since the agents remain infectious for a long distance, a special ventilation room is needed when isolating the patients. And also the patients must wear masks. And when isolating the patient, he or she must be put in an airborne infection isolation room or AIIR. And next one is the doctors that attend the patient need to use PPE such as N95 mask or and higher level of respirators. And the next is the movement of the patient into and out of the room need to be closely monitored. And lastly, by immunizing other people by using vaccine preventable diseases such as measles and smallpox.